Welcome back, everyone. When it comes to a stroke, every second counts, and that's why it's so key to really know the risk factors and the warning signs. Dr. Raymond Caton is an interventional neurologist at St. Francis Hospital. He's joining me in the studio right now so we can talk more about this. Thank you for being here.
Thank you so much for having me. I appreciate it.
I think having a stroke is something we all fear, but a lot of us maybe don't really know the warning signs, and I've interviewed women before. They tend to sometimes ignore them.
Yeah, absolutely. So, we see this still, that, there are some people who kind of say, I know that having a stroke might be that I'm having a facial droop or having, difficulty speaking, but there's multiple different symptoms you can have. So one of the things that we like to talk about in regard to stroke education is the acronym BFAST.
BFAST.
So it stands for different components of things that could happen when you're having a stroke. So the B stands for balance. So this can be disequilibrium. You're kind of moving, swaying back and forth, having difficulty standing upright or sitting upright.
Okay.
E stands for eyes. This is where you may have loss of vision in one eye, both eyes. You may have double vision. You may have difficulty just seeing things on one side of your world. That is always concerning for a stroke until proven otherwise. And then FAST is more of kind of the traditional stroke symptoms that we think of, so fast face, having a facial droop.
Okay.
A being arm or leg. We kind of lump the two together, but arm, any weakness or sensory loss on that side.
Okay.
And then S is for speech. So this is slurred speech. I'm having difficulty kind of getting the words out, or just ability to talk in and of itself.
Interesting.
And then T stands for time, because at the end of the day, as we already said, time is brain. So, every second counts. We want to get people to the hospital as quickly as possible. There's a window for medicines as well as therapies that we can do to treat the stroke in the moment.
So, we've always learned time is brain. I mean, really, the difference of, oh, I wonder if I'm okay. I mean, if you really are, I interviewed a woman once who was Googling the symptoms of stroke, and her daughter instead called 911, and they said that saved her life. Like, you can't really just sit around for half an hour.
You cannot. Time is of the essence. Every second counts. If there's any concern or any thought that there could be stroke-like symptoms, just come to the hospital. Just always, always come to the hospital.
Okay, let's talk about the risk factors.
Yes.
What makes us at risk for a stroke?
So there are certain things that we can't control, like our age, our gender. Women are more prone to having strokes than are men.
Do we know why?
It's not entirely certain in terms of whether or not, it's there are changes in actually age in comparison to gender as well. So it's more common per age for women to have strokes in comparison to men. There's also sometimes atypical presentations as well. There are also things just that are more hereditary as well. So sometimes there are stroke syndromes that run in patients' families. There's not anything we can do about that, but there are a lot of what we call modifiable risk factors.
Okay.
So those modifiable risk factors, those are things are blood pressure, those are cholesterol, if you have diabetes, getting the blood sugar under control, and then if you smoke tobacco, trying to stop that. These are things that we can control to prevent or minimize the chances of having a stroke.
Okay, and let's talk about diet and exercise. Those are such general terms. What do you want us to do? What would be, based on what we know right now, some really good, powerful lifestyle modifications?
Yes. So any type of cardiovascular exercise where you're increasing your heart rate, this is ultimately going to help long-term. Walking, certainly. Walking,
but we should be a little winded?
Yes, I would definitely get winded. Any type of increase in the heart rate for a sustained period of time is going to help. And then diet in and of itself, people have looked at this for years and years. People keep coming back to this Mediterranean diet where it's lower in saturated fats, lower carbohydrates,
lots of fruits and vegetables, lean proteins, fish, olive oil.
Yep.
Okay, we talk about that a lot.
Absolutely.
On just what that is, but those healthy, the stuff that the people in the blue zones are eating. And are we now learning that alcohol really is a risk factor?
Absolutely.
In any level, in any amount?
Yeah. So continued consumption, certainly excessive consumption, that absolutely puts you at risk as well.
And of course, we know smoking is bad.
Absolutely, absolutely. So if you do smoke,
vaping, electronic cigarettes.
There's still trials that need to be done on this, but certainly any type of vaping with tobacco products certainly puts you at risk as well.
Okay. So if you, again, any concern, you want to call 911.
Absolutely.
You want to get, and I know you've got a lot of folks who can help right at Trinity Health of New England. You can learn more at trinityhealthofne.org/stroke. Follow them on Facebook, Instagram, and also at St. Francis CT. But if you think you might be having a stroke, best to just let someone like yourself figure that out.
Absolutely. Come on in, we'll figure it out.
All right, doctor, thank you so much for being with us.
Thank you so much. I appreciate it.
Yeah.